Reporting live from Studio 1A, I'm Sophia.
And I'm Claire.
Today, March 26, 2024, we're celebrating Epilepsy Awareness Day.
We have some special interviews, clips, and information to share, so stay in touch.
First, we have our interviewer Madison talking with a few people who experience seizures in their everyday life.
Let's turn it over to San Diego Beach.
Reporting live from San Diego Beach, we have
Ashley.
here today to report on her seizures. Ashley, what type of seizures do you have?
I have tonic-clonic seizures. Let's go to our seizure specialist, Julia, to learn more about tonic-clonic seizures.
A tonic-clonic seizure is a type of generalized seizure where increased electrical signals are fired and they recruit other neurons to send the inappropriate signals throughout the entire brain. This type of seizure causes both tightening and rapid flexion and extension of the muscles.
Thank you, Julia. Back to Madison and Ashley.
Okay, Ashley, what do you experience when you have these seizures?
I am completely unconscious, but other people have told me that I have a jerking of my limbs, blinking of my eyes, and frothy saliva.
My next question is, do you know when you are about to have a seizure?
Right before I have a seizure, I feel very confused and dizzy.
And how long do your seizures usually last?
They usually last about 1 to 3 minutes.
All right, and how do you feel after your seizure has ended?
I usually feel physically sore, exhausted, and embarrassed after my seizure.
Do you remember when you have a seizure?
I don't remember when I have my seizures, but I can feel the physical effects afterwards.
That was great.
Thank you, Ashley, for sharing your experience.
Next, we're headed to the freezing forest with snow.
Brr, seizures are snow fun. I'm here today in the forest with snow, joined by
Tyler.
and we are here to discuss his seizures. Tyler, what type of seizures do you experience?
Focal complex.
Can you go ahead and describe those for me?
Personally, I don't know what happens.
Back again to Julia to learn more about focal complex seizures.
In a focal complex seizure, an inappropriate amount of electrical signals fire in one area of the brain without the recruitment of other neurons. Whatever area of the brain the seizure affects will impact the execution of that area's function. Many individuals that have a focal complex seizure have an aura, meaning they smell an interesting smell or begin to see spots in their vision. When this aura occurs, the patient knows that they're about to have a seizure.
Thank you, Julia. Back to Madison and Tyler.
Has anyone ever told you what happens during your seizure?
I've been told that I mumble my words, pick at my clothes, and smack my lips.
Do you snow when you're about to have a seizure?
Yes, I might smell burning rubber, I might get deja vu, some changes in my vision like spotting, and I also get really scared.
And how long do your seizures typically last?
I've been told they last about 30 seconds, but they can last up to 2 minutes.
And how do you feel after your seizures?
I feel tired and confused for a short amount of time.
And do you remember when you have a seizure?
No, someone usually has to tell me.
Thank you, Tyler, for sharing your experiences.
It's really moving to hear these stories.
Seizures are not nice.
Oh, I'm out of coffee. Let's go to New York.
Reporting live from New York City, I'm here with...
Penelope.
All right, and Penelope, I hear you have seizures. What kind of seizures do you experience?
I experience absence seizures.
Those are the facts.
Let's hear from Julia, our expert on absence seizures.
An absence seizure is another type of generalized seizure that usually happens in kids and young adults. In this type of seizure, the increase in electrical activity causes GABA to be significantly inhibited in the thalamic cortex neurons. This can cause patients to experience a staring spell and zone out.
All right, Penelope, can you go ahead and describe what these seizures are like for you?
People have told me that I have a brief loss of consciousness and I blankly stare off into space.
Do you know when you're about to have a seizure?
No, my seizures are sudden and without warning.
How long do your seizures usually last?
They usually last around 15 to 30 seconds.
And how do you feel after your seizures?
I don't usually notice that anything happened and I just go back to what I was doing like nothing even happened.
I'm glad you got your coffee.
Me too.
Thank you, Penelope, for your time and experiences.
Next, moving to our very own Kings Island in Mason, Ohio.
Reporting live from Kings Island, we're here today on a roller coaster. I'm joined by...
Taylor.
All right, Taylor, I hear you have some seizures. What kind of seizures do you have?
Atonic seizures.
Turning to Julia about more information on atonic seizures.
An atonic seizure is another type of generalized seizure that causes a significant decrease in myographic activity throughout the entire brain. Here, the body becomes completely limp for a few seconds and can cause the patient to fall to the ground.
Thank you, Julia. Back to Kings Island.
Can you describe what that's like?
I just lose all muscle strength and fall to the ground.
And do you know when you're about to have a seizure?
No, I just end up on the ground.
How long do your seizures usually last?
They typically last only 15 seconds, no more.
And do you remember when you have a seizure?
Yes, I'm completely conscious during the whole thing.
How do you feel after your seizures have ended?
I'm sometimes feel confused, but I usually can return to whatever activity I was performing before the seizure.
That sure looks like fun.
Sure does. I'm so glad we get to hear from all of these people from different places.
I agree. Thank you, Madison, for your time and effort interviewing these individuals.
Next, we have local neuro residents at UCMC to explain the difference between epileptic and psychogenic seizures.
Take it away, Madison.
Reporting live from UCMC Floor 4, I'm here today with Abby.
Sam, we're neurology residents.
All right, and we are here today to figure out the difference between psychogenic and epileptic seizures. All right, any thoughts?
Psychogenic, non-epileptic seizures and epileptic seizures can be very hard to distinguish just with your eyes alone. Really, the best way that we can do that is by having a patient hooked up to EEG continuously. If somebody has epileptic seizures, it means that there's rhythmic abnormal electrical activity in their brain. We'll often start at a small focus like a tumor or a seizure. It's rhythmic spikes, and those spikes can spread to other parts of the brain and lead to the clinical things we see like shaking and loss of awareness. Non-epileptic seizures don't have any of these changes in the brain. Their brainwaves appear normal the whole time. Sometimes you can get little clues that someone's having psychogenic non-epileptic seizures. That would be something like head moving side to side, pelvic thrusting, or non-stereotyped movements, meaning they're different every time the patient has them.
All right, and how would you treat these differently?
So epileptic seizures are treated with anti-seizure medications. Non-epileptic seizures are treated with cognitive behavioral therapy.
All right, and those are the facts.
Thank you, residents, for your time and resources.
For our last segment, we're going to check out what's happening on TikTok.
This'll be fun. Hey, excuse me, what are you listening to? What are you listening to? Oh, awesome. When I walk in a room, all four side rails up, but they all the way padded, so I know what's up. Suction on the wall, O2 present, all the things needed for a seizure being pleasant. In a hospital setting, seizure precaution paradise. In a hospital setting, seizure precaution paradise.
Excuse me. What are you listening to?
I'm listening to Seizures at the Grand Mall.
Walking in the mall, see a seizure. What do I gotta do? Turn them on the side, move the hazards, just in case they puke. Look at my watch to keep the time. If it's more than 5 minutes, then I'm fine. This is all so crazy. Seizure protocol, little hazy. My tummy's turning and I'm feeling kinda nauseous. Too much pressure and I'm nervous. We made sure to call 911. Then the EMS arrived. Then the EMS arrived. Then the EMS arrived. So I put my hands up, wave them over. I know they're gonna be alright. It's a seizure in the mall. Recall the protocol.
Thank you for tuning in to today's show.
Remember to celebrate epilepsy awareness.
Have a great day. We'll see you tomorrow.
Penelope. All right, and Penelope, I hear you have seizures.
Next, we have our seizures.
On absence seizures. We're on absence sheet.
Get last up to even a minute or 2 minutes. Oops.
What am I asking? Is, do you know when you are about to have a seizure?